Hello, good afternoon. I'm Dr. Punnu Shankarapillai, Specialist Neurologist at Aster Hospital, Mankul, Dubai. So today I'm going to talk about vertigo. So what is vertigo? So many patients come to my OPD saying they have giddiness or dizziness. They don't usually use the term vertigo. They say dizziness. So dizziness could mean many things. It's a very vague or non-specific term, which could mean true vertigo, which could mean lightheadedness. It could mean blackening of vision or unsteadiness. It could mean anything. So what is true vertigo? So true vertigo is the spinning sensation of the surrounding or self-rotatory feeling. So that rotatory feeling is called vertigo. So what are the causes of true vertigo? So anything other than this rotatory feeling is not vertigo. It can be called as general dizziness or giddiness. So what are the causes of vertigo in general? So there are two structures in the body that can produce vertigo. One is the inner ear. Any problem with the inner ear can produce vertigo, or any problem with the back of the head. There is a posterior fossa structures, or any stroke of the back, stroke at the back of the brain can produce vertigo. So let's discuss about the conditions of the inner ear conditions that cause vertigo. So the most common type of vertigo that is seen in elderly or somebody past middle age is something called BPPV, that is benign paroxysmal positional vertigo. So as the name suggests, the vertigo is very paroxysmal or intermittent, and it is aggravated by head position change. So the patients come to our OPD and say that they have intense vertigo, and it's aggravated by the head turn or head position change to a particular side. So what is the cause of BPPV? So in the inner ear, there are some structures called canalith or crystals. So any problem with the crystals or any misplacement or displacement of these crystals can produce vertigo. And so this is the reason for BPPV. So when somebody comes with an attack of BPPV, we do something called a canalith repositioning maneuver, whereby we do some positional maneuvers and in the hope that the crystals fall back into their original place. And we also advise some exercises and lifestyle modification. We also give them a short course of medicine to get them tired over that severe vertigo. Then there are other conditions such as labyrinthitis, that means the inner ear inflammation, or something called a vestibular neuronitis, whereby there is inflammation of the eighth nerve, which can also cause intense vertigo. So these vertigo episodes are associated with nausea and vomiting, and there may be some episodes of unsteadiness also, that is difficulty to walk steadily. So in cases of stroke, like the back of the head stroke, that is posterior circulation stroke, there can be similar symptoms, that is vertigo, nausea, vomiting. But in case of stroke, the patients will have persistent difficulty to walk. Whereas in BPPV or this kind of labyrinthitis or vestibular neuronitis, the difficulty to walk is only transient and they improve after a few days. But in posterior circulation stroke, in between the episodes, the patients are not normal and they have persistent difficulty to walk. This is how we clinically identify some, or clinically doubt that this patient could be suffering from a posterior circulation stroke. In that case, we subject them to MRI, and MRI is a very good test to find out if there's a stroke in the brain. Now, there are some other uncommon conditions such as vestibular migraine, whereby somebody with migraine can have intense vertigo associated with headache. Sometimes these episodes can come without headache also. Then there's an entity called Meniere's disease, which is purely an ENT condition. It is a chronic progressive condition. So the patients come to us saying they have progressive hearing loss or progressive vertigo. And this hearing loss also, it's very fluctuating. They say that sometimes they are able to hear well, sometimes they are not able to hear well. And it is also associated with something called a tinnitus. Tinnitus means abnormal sound coming from inside the ear. Sometimes the patients can also feel fullness of the ears. So from the history itself, we can find out if it is a Meniere's disease or not. So these are the common causes of vertigo. So when somebody comes to our OPD with these symptoms, it's very important to take a detailed history and clinical examination to find out what is causing the vertigo and take and administer treatment appropriately. In some cases, imaging or brain MRI may be necessary. Again, from the clinical examination and history taking, we'll be able to come to a conclusion as to what we are dealing with. So this is about vertigo. In the next video, I'll be talking about dizziness and giddiness.